Thanks very much. And Ian, I'll leave you to introduce yourself, if that's okay.
Yeah, of course. So my name's Ian Sinha. I'm a respiratory paediatrician in Alder Hey Children's Hospital in Liverpool. Just in case Apsana does have to shoot off, I just want to say thank you to you for A, such a wonderful talk, but B, for sticking to your principles on such an important matter. We're really proud of you and the rest of the Magnificent Seven. So I'm Ian Sinha. I'm a paediatrician. I focus quite specifically on the lungs of children. I always start any talks these days with some disclaimers. So I'm not a I have no political conflicts of interest to declare. I'm a socialist. I feel like I can say that here.
Yeah.
I'm a socialist. Never been a member of a political party, which is just as well because I would have been kicked out at some point, I'm sure, in the last few years. Socialism and pediatrics are completely intertwined, even if the people at the top don't quite realize that. And over my few slides, it's not a talk per se. I just wanted to share some slides that that I use in talks, which I think you can see my slides now, I think.
Yeah, we can. Yeah, we can see them. Yeah,
excellent. Okay, so so just to put things in context in terms of respiratory health in Liverpool, well, you know, I think I've got the best job in the world, and one of your comrades, Rathi, had dropped me a line the other day to ask if I could join this meeting, and I was over the moon because the two of us did our research jobs at the same time. And it was around that time when certainly I was starting to see that all we're dealing with in terms of the lungs of children is simply just the impact of poverty. You know, these are the types of stories that mums tell us in our clinic. You know, one of my clinics is a baby clinic where I see preterm babies who've gone home in oxygen from around the region. You know, these babies have come very close to death. They've been through hell on intensive care units in order to survive. They'll have long-lasting complications, and yet we send them back to situations where cockroaches will crawl on them and rats will chew the oxygen tubing. And when we meet these families for the first time, what I say to them is, look, childhood is a window of opportunity for you to or for one to help your baby's lungs to catch up. And that becomes really important because your lungs in childhood, same with everything else, grow really fast in the first couple of years of life. And then they sort of grow up until the end of adolescence. And then they hit, you know, someone hits their early 20s and things start to decline. And, you know, we all know this. I'm 45 now. Nothing works better in me than it did 24 years ago. You know, you hit adulthood and you decline. So childhood is quite simply a window of opportunity for optimal body development. And yet we make babies sleep on mattresses like this that are covered in mold that that then, you know, housing agencies will tell parents not to shower for too long because it increases the mold. This is the reality for children. There's a lot of talk at the moment about the fuel, the winter fuel cuts, and quite rightly we're focusing on the elderly. But as a paediatrician, and I say this unashamedly these days, it's a surprisingly controversial thing to say to people, and I often get called up on it. But to me, as a paediatrician, children are the most important thing in the world. You know, nothing has ever come close or will ever be as precious as the little ones in our care. And it's such a privilege and an honor that we have as adults and as a country to help them. But when we think about the houses that babies are going to go back to this winter, cold homes are not just an issue for adults, they're an issue for children. They're already born on different tracks depending on the situations of their families. And yet what we see is that this winter in Liverpool and around the country, the infants who go back to the warmest houses will spend their calories on developing brain tissue, on developing a cardiovascular system that will be healthy through their life course, on developing liver and kidney and lung. And yet the infants going home to the coldest houses will spend their calories quite literally trying not to die of hypoglycemia, of hypothermia. This is the reality of poverty in childhood, that children get sent off on two different, completely different tracks. And it comes back, I think, to an issue of human rights. This is a quote from a new friend of mine. Predrag is a Serbian human rights activist who drew this symbol, which is the universal symbol of human rights. And this is a lovely primary school in somewhere in the UK. And this is a quote from him. Human rights are the greatest human invention in history. They're universal, they're inalienable, they evolve over time, and they confer responsibility. And in the UK, we, as almost every other country has done, has signed up to this idea of the UN Declaration of Human Rights and for the UN Convention on the Rights of the Child, which says that as a country, we have a right, the children have a right to survive and fulfill their full potential. And that includes food, environment, and other aspects of their living situations. And importantly, richer countries must help poorer countries achieve this. There is nothing controversial in saying that children have the right to try and live their best life. And so, with rights come responsibilities. Whose responsibility is it? Whose responsibility is it that since we started this meeting, something like 60 children have died in Africa and Southeast Asia and Latin America from pneumonia, an immensely preventable disease? And whose responsibility is it that the richer the country, the less likely children are to die? This is why I think the issues around child poverty must be framed as an issue of human rights. There is nothing natural about poverty. It is quite simply structural violence. It is quite simply a man-made problem that hits children hardest. I won't dwell too much on this, but this is some work. I'm very lucky these days. I have a fantastic team around me, and all I do is walk around presenting their work. But this was some work that we got from Council Ward data in the UK. We wanted to look at respiratory disease in general, anything where the inside of the body is an interface with the outside of the body is inextricably linked to poverty, and respiratory disease more so than any other type of disease. And what we see here is two things. Whether you look at emergency admission rate, the reasons why people get sick, the reasons why people die, the types of cancer that people have, in the richest 7/10 of the country, respiratory disease is far and away the least important thing. By the time you're hitting the last tertile, the most deprived third of the country, we're seeing that by far and away, respiratory disease is the biggest problem of physical illness that we face. And the second thing we see is that this is exponential. It goes up like this. It's not a straight line. It goes up like this, which is getting us to question, well, what's happening in that poorest third? We heard Mary say, and Apsana had also quite rightly highlighted the feeling around the country around poverty, and Mary had highlighted the demonization of working class people. When you look at a graph like this, the narrative has been for years, for decades, the narrative has been this is the fault of people in the poorest situations. This graph, are we looking at this graph and saying that the poorer you are, that the worse you are as a person, the stupider you are? Of course we're not. What we're saying here is that this is exponential because of systemic failures. We were asked to write a, I forgot to give the rest of my declarations, one of which is that I'm the Northwest NHS England lead for childhood asthma, and another is that I'm on the NICE guidelines committee. I should have said these before, but another thing that we were asked to do was to write a national policy or a national strategy for the Royal College of Paediatrics and Child Health. And we made a big thing about the idea that we're not in a cost of living crisis. This cost of living crisis has always been there, but what we're seeing is that more and more people are being pulled into it. And even then, we didn't get it on the front page of the paper. What eventually got it on the front page of the paper was that the richest people in the country had to cut some costs here and there. What we're seeing with the cost of living crisis is that this is how people have been forced to exist for decades, in terms of insufficient financial income, outgoings that are way too high, and acute shocks to the system. So the model we think about is low financial resilience. And we saw this in the pandemic, that if people can't save, then when there are shocks to the system, they're hit doubly hard. We've seen this throughout history. History tells us that the most vulnerable are least likely to get out of a difficult situation. So in the pandemic, we saw it in Hurricane Katrina, where the richer population left and the poorer, largely black population of New Orleans stayed behind and suffered. We even saw it in Titanic. Titanic was one ship. It hit one iceberg, and yet the people traveling third class were 3 times as likely to drown. This is the Titanic model of poverty. This is the idea that if you're in a difficult situation, the less money you have, the less you can get out of it. It's not always intuitive to people as to why this is the case. Why does poverty lead to health inequalities and differences in life expectancy of 15 years across Liverpool? Those of you who've been in Liverpool will have been to the centre. If you'd taken a 15-minute train to the outskirts of Liverpool, where I live, it would have added 15 years onto your life expectancy. Now, why is this? Well, firstly, families are priced out of giving their children a healthy start in life. That includes food, that includes housing, that includes heating. The eating or heating thing has become a bit of a catchphrase for people, but it's a very real thing that families face in our clinics. They either have to spend money coming on the bus to come and see me, or they eat. They either have to feed themselves or feed their children. This is the reality of poverty in childhood. And going back to this idea of an exponential increase in problems in children and people living in poverty, this is what we're starting to examine with some quite sophisticated data science at the moment. Is why is this happening? Why is it exponential? And what we see is that children aren't exposed to one adverse factor. These adverse factors cluster together, and in fact they play off each other. So exposure to indoor air quality increases your risk. A poor indoor air quality increases your risk of asthma attacks a bit. Same with outdoor air quality. You put them together, the risk is disproportionately high. These things play off each other. And the very children who are most exposed to poor quality air that affects their respiratory system are the very children who would benefit from green diet, from high antioxidant foods to protect them against the free radical chemicals that pollution cause. And yet these are the very children least likely to access them. We know that sleep is a crucial part of your respiratory system. Your sleep is the time when your respiratory system and your brain and everything rests. And yet the very children living in the worst houses, through no fault of their own, are the children sleeping on 60, 70, 80-year-old mattresses with 7 children in the room, absolutely surrounded by mold. How on earth is that any kind of way to talk about, to start conversations about a northern powerhouse or whatever the term is? The northern powerhouse in Liverpool has been falling asleep in class today because they do not have a living situation that is safe or acceptable to them. We know there's an inverse care law. The children who would benefit the most from an intervention are least likely to get it. And this, for me, is the biggest argument for universalism. There are issues that drive this that we can absolutely overcome with universalism. Why? Because stigma is the very machinery of inequality. We all see it. We see it every day. And our mainstream media and our governments over the years have absolutely played into this false narrative. And then finally, there is a biology associated with poverty. We've been saying for years, poverty gets under your skin. It doesn't just get under your skin. There is good research evidence showing that living in poor situations as a child affects up to 10% of your DNA. Now, I do over the years, I've done various talks for Ian Burns' Fan Supporting Food Banks Network. These are Zoom calls of big men, like big, bald men. That is the line that makes them cry, that poverty literally gets into the molecules. The molecules that make up who we are can be affected by the situations in which we live. And it's this that sends children down the wrong path in terms of health. It's this that makes them die 15 years earlier. And all these things are driven by corporate and political and societal vectors of disease, because that's what they are. These are things, the decisions that we make at the top can either end or promote suffering. And when we think about when I was growing up and I was primary school, that was in the Thatcher years. And what became very evident to me, even in primary school, is that you can strip all the stuff away. You can take away everything from a community, but the absolute killer is when you take away the self-worth of individuals and the self-worth of communities. Why is that relevant to a pediatrician? It's relevant to a pediatrician because I work with various places across the Northwest, and children, the most recent sort of ridiculousness has been children in Barrow-in-Furness living in tenement housing that's been infested with pigeons, and I'm getting letters saying, is this bad for children? Yeah, yes, it's bad for children. Rathi's expertise when we were doing a research was about infection. There will be children with poor immune systems who are at risk of fatal infections because somebody doesn't want to put their hand in their pocket. I'm going to skip through a couple of slides to get through to this one. Many of you will recognize this man here. This is Ian Burton. We're fortunate to have him as an MP in Liverpool, another of the Magnificent Seven. And we've been working on the Right to Food campaign. And you may wonder why they have a purple bus. Everything public in Liverpool is purple, because if they had a red bus, it would aggrieve the blue half of Liverpool. If they had a blue bus, it would aggrieve the red half. So they have a purple bus. They do wonderful work. And alongside all of this, they maintain people's dignity, which is crucially important. When we think about the pathobiology of poverty, it's inextricably linked with the pathobiology of trauma. And what we see is, particularly in the respiratory system, but also in other aspects of child health, that trauma in childhood, stigma and anxiety, and the difficulties that children face are things that they hold here. There is now, we used to talk about this and people thought that this was just some lefty biology. There is now very good evidence that you hold trauma here. You hold it in your respiratory system. And so when we see children coming to our severe asthma clinics who've watched their mums being beaten up, who live in houses with rats, who haven't eaten for days, who have to take out a loan to get a bus to come to our clinic, then of course this is going to manifest itself in physical ways. I'm going to finish with a couple of examples of where we need to go next. And the key answer is, this isn't about tinkering around the edges. This is about high-level, upstream, left-field change. We know that if you have a smoking ban, there's a reduction of 10% in childhood asthma admissions that happens almost immediately. Even if this ban is in pubs and places that children aren't supposed to go, we know that the levy on UK soft drinks, high-level interventions led immediately to improvements in child health. And yet the difficulty we have is that people tell us that you can't change regulations until somebody dies. Children are dying. They've been dying for years. This is the rates of infant mortality by deprivation. So the line at the bottom, that blue line there, is the rate of infant mortality in the richest tenth of the country compared to the top line, which is the poorest decile of the country. And so basically children are twice as likely to die in the first 2 years of life based on what? Based on the situations in which their parents have lived. In what world is that anything other? If you know that this is happening and you don't do things to change it, there is graffiti in Manchester, and I'm paraphrasing and sort of coining a phrase here, but that is just state-sanctioned infanticide. If you know that this is happening and you don't fix it, then there's something wrong with the moral fiber of how this country is run and has been run. And we know that the children who are most likely to die are children who are exposed to these problems for various reasons. We ended up taking the Environment Agency to the High Court, which went down very badly with my bosses because they said, why are you doing this? This is a landfill site in Newcastle under Lyme, just outside of Stoke-on-Trent. This little boy in the middle was born prematurely and has bad lung disease. And we took the government to the High Court to say that having a landfill site that is completely unregulated by a body that is not fit for purpose, in my opinion, will be a threat to his life. Perhaps now, but definitely in the future, because of this idea of a window of opportunity. This kid needs to grow lungs faster than his peers. He needs to catch up to his peers. Otherwise, he'll get COPD and he'll die. And so if we put things in the way of that happening for no reason other than some businessman somewhere getting rich off the idea of dumping carcinogenic, toxic waste next to working class children, then we are part of that problem. This is the corporate and governmental vectors of disease. This lovely lady here is a parent champion. We've been trying to change things. So we have now set up a scheme where we have 10 mums who work in the most deprived parts of Liverpool. We taught them about respiratory health. We taught them about breastfeeding, smoking, housing, domestic violence, all the kinds of things that affect children's lungs. And they cost marginally more than I cost the taxpayer. And immediately they saw a 25% reduction in respiratory admissions in babies in Liverpool. Other people are starting to use this model. They're calling it the Liverpool Parent Champion model. Can I get it funded in Liverpool? No, I can't. Why? Because it's children. Children are bottom of the pile. If this was something that benefited overweight middle-aged men who have hypertension like me, I'd get it funded like that. But because it's children, because it's babies, we find ourselves scrabbling around. Very briefly, with 2 more slides, and I apologize, Coral, I feel like I may have gone over, so I will be quick. I just want to finish, or nearly finish, by saying the NHS that we know and love is not blameless in this. We did some work within our asthma clinic. This is my wonderful, wonderful asthma team. I think they're the best team in the world for asthma, and other people agree. I'm fortunate to work with them. And we looked at what we did and we said, we're not providing evidence-based care. We're not using data about children, and we're not empowering children. We did some work to see what it meant to be empowered. And the gist of this is that by doing that process in a structured way, we eliminated health inequality in our regional severe asthma clinic. Again, like this, you make big changes, you see immediate benefits. One of the things that we tied in with the asthma clinic is a clean air clinic. So we know that families get gaslit all the time, particularly mothers get completely gaslit about their housing. We were seeing mothers coming with obvious mold like this and damp, being told that this is just condensation. Maybe they need to wipe their windowsills better. And they're turning up to housing agencies and private landlords with cardigans of their newborn babies, cardigans and mattresses that are unusable after 2 weeks because they're covered in mold. So what we do here is we offer agency for family. We try and poverty-proof the services. This is where we're going next, and it ties together, I think, what's happening, what's been said by both Mary and Apsana. This is about a community approach. Like this, how do you translate a national headline about health inequalities to something local? Well, you go local. So this is what we're now approaching things at. I went up to Barrow in Furness, place with its quite unique problems, quite literally unique problems. And this is where we need to go in terms of addressing child inequality. We need to think about the better, more impactful use of data. We need to co-create any solutions with families, not top-down nonsense that doesn't work. We need to hear from families what they want, and I can absolutely guarantee you it will be universal free school meals. We need a rights-based approach, because this is an infringement of human rights for children to live in ridiculous places like this. We need evidence, which is where doctors come into this and researchers come into this, and we need to make sure that the cracks are filled in. I'm going to stop there because I do feel that I've probably gone over time, Coral. But
no, it's fine. It's been amazing. Yeah. So Apsana's had to leave, but please, anyone ask Ian,
She
a
may
question.
come back,
Inba.
Coral. She's had to
She might
take
come
a
back.
call.
Okay, great.
Yeah, she's had to take a call. She said she'd try and come.
Okay. Inba, go ahead, please. Yeah.
Hi. Yeah, a lot of people, thank you very much. It was really, really interesting. All the contributions were fascinating and very sad. I work in a special needs school in Hackney. Today, this afternoon, I was supporting colleagues in a neighboring school that is going to be shut, that one of the schools at Hackney is going to be closing. The reason that they're closing, Hackney is planning to close the schools like a lot of other London places, boroughs, is because there is a falling rule. The thing about it, the reason for a falling rule is actually very not dissimilar for the reason for the bad housing conditions. It's all come back to the Thatcher's legacy of selling council homes. When we started to sell council homes, there were no more council homes to be made. So this brings a lot of the people into private households, private landlords that don't have are not regulated and are not able to. They're not providing the right conditions for those children. That also means that people can't afford those, and they have to live at London, and this is why the schools are shut. I mean, this is obviously the completely wrong solution to shut the schools, but this is another conversation. Please join us on Monday next to Hackney Town Hall at 4:45. But I would like to kind of to know more about how many of the housing that you refer to in Liverpool are privately owned, and how many of them, if any, are council owned, because I'm sure there's a link between.
Yeah, and all is it's a great point, and I'm sorry to hear about that school. It's another example of how mismanagement by adults is felt by children. You know the very children who would benefit most from that school are going to lose out. And when we look at different places across the country, it's a great point as to why we need hyper localized approaches, because things are different. So apologies in advance for a slightly long-winded but a really like a really formative moment in my mind was when we went to Barrow. What I learned from Barrow, and I know your question was about Liverpool, and Liverpool is there's a higher proportion of housing agency housing, and there is also a large private market. In Barrow, which I only realized by being there, there is a single dominant employer. So this is BAE. This is the company that that's going to build Sir Keir's nuclear submarines, right? So this is going to go through Barrow. Now, when you look at Barrow, when you go up there, I ended up after a couple of hours of being there saying, do you not have a coercive relationship with this company? And everyone said, what do you mean? And I said, if BAE, the company, was a man, and Barrow in Furness was his wife, and he said, you only exist because I'm here. I'll manage the money that comes through because you won't know what to do with it. And if you kick up a fuss, I'll leave. If that's not a coercive relationship, then I don't know what is. And the difficulty with a place like that is that investors around the world, people who've never been to Barrow, people who live in Dubai and Australia, have bought up a huge proportion of those houses and they privately rent them. There is no link between them and this town where children are dying at higher rates than other largely white working class towns. Okay, so the difficulty that we have by trying to take a large approach to this, and I think this this does touch on what you say, is understanding the mechanisms of the housing problem in the place that one is trying to address becomes crucially important. And I couldn't agree more that Thatcher has blood on her hands for what is happening to children living in substandard housing these days. The housing situation, the housing arena is an absolute mess. It's an embarrassment. That's why we set up that clinic, because we found that the only way to get children moved, I mean, you know, we've got families who sleep in cars with small babies because their housing is so unsafe that if they switch on the light switch, sparks are coming out of the light shade. So in the snow, they'll go and sleep in cars with newborn babies, sleep in taxis. You know, we've got children who are going through these types of situations. And when they say that to people, everyone goes, there's not enough houses. So the whole purpose of the Clean Air Clinic was that we used to write, oh, dear council, dear housing, oh, dear landlord, I'd be ever so grateful if you might be able to fix X, Y, and Z. And now we write letters that say, your house will kill this child. Dear CEO of X housing agency, your house will kill this child. It goes direct to them. Don't even bother going through people that are just going to put it on a desk now. We just go straight to the CEO. We've had to phone them up and say, you know what, or phone up the press agencies of councils and places and say, just so that you know, we're going to speak to the Guardian about this, and you've got a week. And then they move. Suddenly there is housing. So the whole thing is a complete disaster, and children are usually at the bottom of the pile for this. But we do need to think about ways of moving things forward. You would think that one of those answers is to build more housing again. And I'm sorry to go back to Barrow. My colleagues are sick of hearing about Barrow in Furness. They're like, why have you got so obsessed with this place? In Barrow in Furness, they got £200 million of levelling up money. £200 million. And not a single penny has gone to children. And the rest of it has gone to building £700,000, £800,000, £900,000 houses for people to come from around the country to build nuclear submarines, right? I mean, what is that? What type of society is that? If that is not money over children's safety and their lives, then what is? So I think you're exactly right. Understanding the mechanisms in individual places is entirely right. And I'm sorry to hear about that school. That's sad news.
Thank you very much. Judith, if you can unmute yourself.
Yeah, what a fantastic presentation, and your answers are so brilliant. I'm from Birkenhead, which is also an area of great poverty and deprivation, and I can feel so strongly with what you're saying. I see this in Liverpool too, and I've seen the advertisements on the underground that seem to have gone now, which were about asthma in children. Good luck to you. Are you not making a case for us to return to a proper local public health system? That's gone into abeyance since Thatcher, again. So much can be laid at Thatcher's door. And I really feel we should have that back again. Nothing works properly because we don't have an effective public health service anymore.
Judith, it's nice to hear from you. I was born in Birkenhead. I was born in St. Kath's Hospital, and I grew up in the northeast in Middlesbrough. And then there must be something about Merseyside that just pulls you back when you're a grown up. But yeah, I think you're exactly right. There's something both about how public health works and what public health is. But also the funding for public health. So one of the key things that we identified in austerity, which everybody on this call knows, I say this to other people and they go, wow, you guys will have known this for years, that austerity doesn't hit us all the same. It's like the iceberg that hit Titanic. It didn't hit everybody the same. Austerity hits working class, northern particularly, but also around the country, working class people who are at risk of dying earlier were hardest hit by austerity. And we saw the same with the cuts to public health funding, and quite literally the public health fund around the country as well, that it hit the poorest places the hardest. And if we delve into that, it will hit children the hardest as well. One of my colleagues at the University of Liverpool, Dave Taylor Robinson, was slightly ahead of Rathi and myself when we did our research. He's a world-leading public health expert in children.
I know him, actually.
You know Dave, he's a great guy. He's a lovely, lovely guy, a brilliant man. And he did some analysis showing that during austerity, the rates of, so generally over time, infant mortality rates go down. Infants are generally healthier. Around 2015, we saw an unprecedented uptick in infant mortality, exclusively driven by the poorest quintile, and in my mind, largely contributed to by the cuts to public sector funding, including the public health fund. We've had public health people really don't like me because so, for example, the UK HSA or OHID or Public Health England or whatever it was called, when we took the landfill case to the High Court, and so there was me, a barrister from that town, and one guy, like the mum of the baby, and the rest of the High Court is full of government barristers, and Public Health England are on that side of it. And they're saying, you know, so there's two layers of public health here. There's real public health, on the ground public health, and there's what happens when public health people are pulled into government agencies. And the two of them need to be separated. These guys don't have the same thing. You know, it's like the Environment Agency. The people that go into the Environment Agency are fantastic. I've got no issue with them. I've got an issue with what the ethos of that whole thing is, because it became very clear to me that it was about protecting, at that time, the Tory government.
I agree.
So I think there's really deep-rooted things. And Judith, you're not a million miles from me, so it'd be lovely to meet you one day.
I would love that too.
Yeah. So, Ian, that's amazing. Thank you very much. Matthew, did you have your hand up to ask a question?
So yeah, I did put it in the chat, just aware of time, but it was more of a comment really, that and thank you so much, Ian. I mean, the talk was absolutely brilliant, and all of our speakers, it's been brilliant. I just wanted to remind or make people aware that we do have allies that we should be engaging in, although we are a health-based association. So for example, London Renters Union, they have a damp and mold campaign, and they have local branches as well. So our Brent branch of the Renters Union also, you know, have a very active campaign, and, you know, present petitions to council, and it's really important to get the councillors involved as well. And the other action that I'm aware of that I wanted to mention was MedAct. So I mean, locally in Northwest London, we also have the Harrow Law Centre. We, you know, MedAct have had paediatricians come out and, you know, help to support in individual campaigns for individual cases against landlords as well. So I wonder if there's something for us, at least as a branch, kind of looking at this more broadly, to look at some of the campaigners in the other sectors, as well as the education union, but maybe looking at people who campaign in the housing sector as well.
Yeah, MedAct has a big housing campaign as well. And then there's also the Labour campaign for council housing. They've got, they're trying to push for publicly owned housing as well. Yeah. And of course, there's a huge problem as well, like in Hackney, where I'm from, where the council housing was sold off for £1 to the housing associations back in the early 80s. And of course, we've got Peabody and Sanctuary here, and they've got dreadful problems with mould and disrepair, and the council seem to have no control over them at all. They don't say, you know, oh, we had a lazy ward councillor, and we used to ask her all these things. She was on the housing thing, and she'd say, oh, no, we can't unless we get the Environment Agency in. I just don't understand it. They've just given up any responsibility.
It's nonsense, and it becomes, and we see, you know, I see this in my day-to-day work, that if you run things like businesses instead of running them like services, this is what I had to say to one of the dinner ladies in our hospital today. I said, right, the patient has been given his dinner. His toddler little sister is saying she's hungry. Give her something to eat. Like, what, you know, if she was at your house, would you say, no, you weren't an invited guest? And it's the same with this. If you've got families who are living in difficult, dangerous situations, the default has been for years to say, well, you know, there's no housing. That's a great disclaimer. There isn't anything I can do. There's always something people can do. You know, there is always something people can do, and advocacy is a huge part of this. So groups like yours are hugely, crucially important for driving change and changing the narrative about what we say about these families. So yeah, I'm grateful to join, but also it's really impressive to see the linking and the working and the advocacy that you're doing.
Well, thank you very much. And Radhi's just sent me something about insourcing. I thought it was really interesting. We were talking about the free school meals in terms of the Preston model, where you local things. And even if a school can be a little local thing. And by insourcing food into the school, you're giving community and job opportunities, and you can also have people going there learning how to make food. And I mean, it's just a different way of seeing things.
That's another project that we've been starting in Liverpool, and the school meals stuff. There are a couple of things that we're doing, and one of those is about a year. I can't remember. At some point in the last couple of years, I did a talk for some union, or I can't even remember. And I said earlier that anything that's inside your body that interfaces with the outside world is at risk. And so I've said for a long time that dinner ladies are the interface between poverty and education.
Wow.
And then there was a dinner lady who put her hand up at the end of the call, and people, I was trying not to cry while I was talking. She said that in their school, when the children come up to the till, if they've got a toastie and a drink and an apple or whatever, and it comes to more than £2.40, if they haven't got enough money on their card, they have to put something back. And I said, what do you mean? And she said, the managers stand behind them, and sometimes they try when they can to sneak stuff through, but otherwise the children will have to go and put it back, and they slink off. I said, what happens next? She said they slink off into the dining room, into the canteen, sort of into the darkness, kind of hungry. I said, what happened next? What happens after that? And she said, then you look up and you see the other children sharing their food. I mean, it's absolutely insane that this is happening in this country. But I then said, well, who is the absolute dregs of society that are making, which ridiculous company do I need to go after to stop this happening? Lancashire County Council. And I'm just thinking, where do we go? Like, if you run this in that way as a council, where do we go next? It becomes really difficult. And again, this is a long game battle, isn't it? But you guys are doing great stuff. You're doing great stuff.
Yeah, thank you very much. And I think it gives us a lot of. It's very difficult to think how to influence the Labour Party, because they've got this narrative. There's this whole, wherever this idea that they've got, the government's got no money except for bombs. But but I think councils are a place where we can all act, actually. I mean, I know they can feel pretty distant, and they seem to be very good at making up rules to stop people speaking. But it is somewhere local that we can all try and influence, I think, and it's very important. Yeah. So I just, we're sort of at 9 o'clock now, but we've got one last piece of business, which is Alan Hall. Are you still here, Alan? Right. Okay. We've got one vacancy on the Central Council from London, because Rathi is on the Central Council, but in a different capacity, and she was previously from London. So Alan has volunteered to fill Rathi's shoes. And I just wondered if you'd mind talking for a couple of minutes about your experience working with health, so we can invite you onto the Central Council. You'll have to unmute. Yeah, that's fine. Thank you, Alan.
Thanks, Coral. I'll be really brief, because I think it was great to hear all these presentations tonight, and there is a common theme, and that is the hyperlocal and public health done properly. That's what I like to badge it as, done properly. I mean, in all the billions that were spent during COVID, nothing extra for public health at local level really came about, and the public health grant, as you all know, remains cut and continues to be cut. And I don't think there's been any announcement there'll be any relinquishing or any correction of that still till today. My experience, it started, I suppose, many years ago when I was on Lewisham Council. I was a public and patient involvement person at a community health council. I was a trustee of something called the London Lighthouse, which was an AIDS charity. And through all of these tsunami of public health, I call them public health events, what I've seen is really the rowing back of the role of local public health to the state we're in now, where people are scrabbling around for quite small sums of money to make quite big differences. So, I mean, I would just to ask is that I would like to, I think we've got an opportunity with the Labour government to make this case. The central, I've been on the Central Council before, I have to declare that. And I just thought, is it time for me to get my enthusiasm, put myself forward, and perhaps see if I can help with the team to push on that and that on that general theme. So that's my pitch for tonight. And I've written a quick statement that you can all read. Thank you.
Okay, yeah, I can send it around for everybody. Yeah, thank you very much. So hopefully that's fine with everybody, that we could welcome you to be on the Central Council from London. And we look forward to your contributions, that's for sure. Thanks everybody so much for coming. And it's really worth giving us loads to think about of where we can go forward and what we can do as the SHA. And we are in a sort of privileged position in the sense that we are affiliated to the Labour Party, so we've still got, hopefully still got some influence there, but we'll see how that goes. Has anyone else got anything to say before we finish, wrap up? Thank you all very much. It's nice to see people from around the country. There's people from up in the north as well. And yeah, we'll see you all soon. Well, we'll let you know when the next meeting is going to be, and we'll send out the minutes, and the recording of this will be available, so we can send that out so people can access it as well. So thank you all very much.
Thanks, Coral, and thanks everyone.
Thanks, Coral. Thank you. Thanks, everyone.